Okay, so I briefly touched on this topic this morning, and I talked about how after a patient is declared brain dead and, we give the family a time to grieve and accept that fact, and we come up with a plan or a time to terminally extubate, the RT will turn the ventilator off and then deflate the cuff and pull the ET tube out while the nurse is right next to her with a chuck and suction. I talked about how it could take a little bit of time for the heart to stop once the ventilator is disconnected. And then a doctor on this app with over 100,000 followers commented on that post saying I was spreading misinformation, which is something that I don't play about and take 100% seriously. I have taken care of brain dead patients. I have accompanied families during this grieving process, and I am really just telling you guys what I see as the ICU nurse. And I want everyone to remember, when I am discussing these things, I am speaking within my scope of practice, within the ICU nurse scope of practice. I'm not a trauma doctor. I'm not an intensivist. I'm not an ICU. I'm not a doctor. I'm not a respiratory therapist. I'm not a pathologist. I'm not a sonographer. I'm an ICU nurse. So when I speak about things, I speak on them from the ICU nurse's perspective. I just want to make sure we're all on the same page.